Hello, good afternoon. Welcome to the final Advocacy in Action webinar for 2021. This has been a pretty interesting and challenging year on many levels, but we have had a lot of progress in our advocacy efforts, and particularly around the Medicare Orthotic and Prosthetic Patient-Centered Care Act. So we welcome you all joining today, and those of you that are watching the recorded session. And we're going to go through some of the I would say wins and some of the experiences that we've had that have led to what we now have as the most co-sponsored piece of legislation that we've ever introduced here. So this piece of legislation has received more co-sponsors on the House side and Senate side than in previous Congresses. So let's start there to give people a recap of the year and sort of where we're at. I'm going to share my screen, and if you're not familiar, you can always look these bills up and their progress on congress.gov. So let's see if my can someone let me know if my screen is sharing? Awesome. Yeah, are you all seeing congress.gov? Great. Give me a thumbs up if you're seeing it. Yeah? No? Uh-oh.
Yeah, I can see it at least.
Oh, great, good news. Okay, so we've got congress.gov pulled up here. This is a great way for you to check on the progress of our legislation. Right now, HR 1990 and S 2556 are the only two active pieces of legislation that AOPA is supporting right now or lobbying for. And if you ever are interested to see what the co-sponsors for each of these bills look like, so the original sponsor is going to be noted here. In this case, it's Congressman Thompson from California's 5th District. I had an incredible opportunity to have dinner with Congressman Thompson at his home last week. It's been one of the best opportunities I've had in my experience as AOPA's lobbyist, and it was an incredible opportunity, and I feel so fortunate to be able to talk through the policy issues and share a meal in his home. It was very cool. It was a highlight of my year for sure. He is our lead sponsor in the House, and if you scroll down on that page in congress.gov, you can see here there's a tab for co-sponsors. So you can see how we're doing here. Again, I said this is the most co-sponsors that this bill has ever received. So this bill's been introduced twice in 2 different Congresses, and this is the most co-sponsors that we've had so far. So looking down here, you can always tell, it's what state they represent and their district. So you can see if your member of Congress happens to be on this list. And again, we've had a really successful campaign this year in support of the Medicare Orthotic and Prosthetic Patient-Centered Care Act. If you have questions about the support of any of these individuals, or if you have any comments about any of these, if you want to pop those into the questions panel, please feel free to do so. But we're going to walk through the Senate side as well, but I just want to pause and say thank you to those that are joining us on the call today for any outreach that you might have done. So I happen to know that there are several folks that have joined us that have gone to aopavotes.org and made their voices heard by writing their members of Congress. This is the way for you to get that initial outreach to your member of Congress, both in the Senate and in the House. And so once you've got your voice heard there's opportunities, always opportunities to follow up. Hopefully those offices will follow back up with you if you've reached out to them through the platform. But if not, we're always happy to connect you with your member of Congress as well. I will share that that's a couple weeks ago we had the opportunity. Jeff Brandt came into town. Jeff Brandt is an AOPA board member. He came into town, and Sam and I, this picture down here, you'll see Sam and I had the opportunity to go to actual Hill visits in person with Jeff Brandt and for his members of Congress in the Pennsylvania area. And immediately following some of those meetings, we had co-sponsorships. So we got sign-ons just immediately from those meetings. Sam, anything that you want to add about those meetings that stood out to you, just in your experience? It was Sam's very first in-person meeting, and it was with a member of Congress. That rarely ever happens, but it happened with these meetings with Jeff Brandt. So wanted to give him an opportunity to share if he has anything he'd like to share.
Yeah, absolutely. I think something that really stood out to me was just the engagement that members of Congress had when there was a constituent sitting there right in front of them, talking to them about the issues that they're facing as a business owner, as somebody who wants a policy influenced in some way. I think another thing that I really enjoyed was the fact that you kind of make these small connections and little things you might not expect. On one of our virtual calls during that day, one of our staffers, or one of the office's staffers actually, they told us that they had a carbon fiber AFO since they were about 5 months old, and they had been seeing the same orthotist that whole time, and they must have been in their 20s. So it was really cool to make that connection. Those little things go a long way when it comes to legislative influence and advocacy work.
Such a great point, Sam. So actually what happened, we always ask the question, what is your experience with individuals living with limb loss or limb difference? Do you know anybody? Do you have anybody in your family? And this person happened to kind of hold back a little bit at the beginning of the meeting. And he waited till the end. The staffer waited till the end, and he said, "I've had the same orthotist since I was 5 months old." And so it's just that he said, "I wear a carbon fiber AFO now, but I've had the same orthotist since I was 5." So it was that moment where we were able to really make a connection with a member of Congress's staff about an experience that they had had with a clinician and the importance of that clinician's role in their rehabilitation and just their day-to-day lives now, because he continues to live with his condition that needs orthotic intervention. So Sam, you're absolutely right. It was a great opportunity, and we capitalized on that opportunity. We took advantage of that moment, and we said, okay, we found a member of this team, and we know that they're going to be on our side. We know that they understand the issue that we're bringing to them. And this particular staffer, we were able to make a note in our internal system just to say, okay, next time we follow up with this office, we want to make sure we reach out to this staff person and say thank you for their time, and then also know that they're going to be on our team for anything that we need in the future, not just this bill. So much of this is about building relationships, Sam, so you're absolutely right. So I know that I've noticed that a few additional people have joined us. And so since we've got some new people that have hopped on, I'm going to go back and just say again how fortunate we feel that we've got so much support in this current Congress. This is the most co-sponsors the House bill has ever had, and many of these are previous supporters of the bill, and many of these are brand new supporters. And I know for a fact that some of these are only supporters because you all have gone to aopavotes.org and you've reached out to your members of Congress directly. And so your input is invaluable when it comes to getting co-sponsors. The number of co-sponsors is going to help us when it comes time to have this heard in committee, that they'll see that there's a lot of support out there, and that support is bipartisan is really important. So, there's 2 committees of jurisdiction here. We were talking about congress.gov and a way that you can always access information about the legislation and get updates on that legislation. These are the 2 primary referral committees of jurisdiction, and we did a webinar a few months back about these committees of jurisdiction. But that's always a good note to make. And you can see when you look at the committees that many of the co-sponsors that we have are actually from these committees, which is even more important. So a lot of our advocacy efforts have been geared towards getting members of these committees to co-sponsor the bill. Joy, do we have any questions so far?
Not so far, but that's a good point. If you have questions, if you can drop them into the questions field, Ashley and Sam will get to those.
Great. So I'm going to pop over, since we don't have any questions about the House bill, I'm going to pop over and share our progress with the Senate bill. So you'll see that here the Senate bill is its primary jurisdiction is in the Senate Finance. We have introduction by Senator Mark Warner. He has been a longtime champion for orthotic and prosthetic issues, and also for the patient advocacy side as well. So he's a longtime supporter and is really a true champion in the Senate for us. There are 5 co-sponsors on the bill. Again, this is a bipartisan bill. We just found out that Senator Thune of South Dakota has also signed on as a sponsor. So it's not showing up in congress.gov yet, but we got the email from his chief of staff this week confirming that Senator Thune would be co-sponsoring the bill as well. We probably have, I don't know, 6 total, 3 from the Senate, 3 from the House that have confirmed, but have not been added officially in congress.gov. So we're always tracking those to make sure when they tell us that they're going to sign on that we follow up, and if we don't see their names pop up, that we reach out and say, hey, you said you were going to co-sponsor, but we haven't seen your name pop up yet. But again, this is a really good presence for us in the Senate. This is a harder ask for senators. Some of the senators that we've met with have said things like, oh, this isn't my committee of jurisdiction, so I don't co-sponsor things that aren't in my committee of jurisdiction. So that's always a challenge, but the way to overcome that challenge is to have constituent voices reach out to those members, and they're much more likely to co-sponsor when they have a strong constituent pool. Anything I'm missing on the Senate side, Sam, that you can think of?
I think you covered it pretty well. I think on the with regard to the kind of lag time it takes for co-sponsors to get added, there's definitely like a formalized process where they have to kind of get their co-sponsorship request in writing, and it's got to go through some channels. So we had some moments where we would get kind of a verbal and a written confirmation of a co-sponsorship, and then we would kind of sit there for a couple weeks and let it kind of percolate until it showed up. So if you don't see something right now, just it'll get there.
And that's a great point. If your member of Congress has confirmed, in a meeting, if you happen to be making outreach to your senators or members of Congress in the House, and they say, oh yeah, we're going to co-sponsor this, but then you don't see it happen, don't be worried. It will happen. It just takes some time, like Sam said. I don't have patience when it comes to this stuff. So where is it at? But it's all good. I get excited and I want to see it happen in real time, but that's not the way Congress works. So I think now is a great time to show just the sheer amount of work that's been done the past few months. So this is a little behind the scenes, but I'm going to share it anyway. So our team over at Austin and Bird, our lobbying firm that supports us in this, they keep this like tally of all of our meetings. So this is Senate Finance. SFC, just as a note, means Senate Finance Committee. So that's how this works. It's going to be listed that way. And when I say that the committee is important, it absolutely is important. It's the first thing on their list. But you'll see here, these are all of the offices that we've met with. And this is just in the past few months. So really, really serious work that we've been putting in and pushing for these co-sponsors. And it's incredible to kind of see how, we check these off. Okay, yes, we've met with them. Yes, we've met with them. Yes, we've met with them. These are the days and times that we've met with them, the outreach that we've done. And over on that far right column, you can see that we had a lobbyist from our lobbying team in support of those meetings. Oh, sorry about that. So yeah, we are constantly, pushing along and moving forward and getting these meetings done. We've got a few more scheduled for the rest of the year. It's kind of surprising to say that, but we do still have some meetings. We finished our last in-person meetings last week. I had the opportunity to go to a breakfast with Senator Tim Scott and a dinner with Senator Cortez Masto, both which were really inspiring and awesome opportunities on the Senate side. And then I had, as I said earlier, I had dinner with our champion in the House, Congressman Mike Thompson, so at his home, which was really, really cool. So we're having conversations at the highest level possible to get support for this bill. And it's showing, you know, it's so much work to get just a signature on a piece of legislation, but it really is working. And again, your voices are instrumental in that. We shared earlier that Jeff Brandt, our AOPA board member, came into town, and we were able to support him in his meetings on the Hill. And we would encourage you all to do the same. If there is an opportunity, if you happen to be in the DC area, or you're interested in coming into the DC area for any reason, and you'd like for us to set up meetings for you with your members of Congress, we are absolutely here to do that, and would be thrilled to have you join us on the Hill. All you got to do is let us know that you're going to be in town, and we'll get to work making sure that you get some meetings set up. And if there's a way that we could be, if you think that there's things that we could be doing to engage, you know, AOPA members, you all, on those opportunities, we welcome your feedback about that. I think what was surprising to a few people was to find out that they could even do that, you know, that they had the opportunity to come and join us if it wasn't an official policy forum or something like that. This work is being done every day. There's no reason to wait till the policy forum. We could always utilize a constituent voice, especially as we are beating the pavement and trying to get more and more co-sponsors signed on. All right, so I do want to open it up. This is a year-end wrap-up for questions at the end. I will share a little bit about our trajectory with this piece of legislation. We were really hopeful that there would be an end-of-year package that would have non-controversial bipartisan issues attached to it, so a package of Medicare bills that we could use to tag our legislation onto, that would pass without objection. It doesn't look like that's going to happen this year, and that's primarily because so much has been going on in Congress. We had to fund the federal government. We had to certainly prevent the debt ceiling from, you know, we had to raise the debt ceiling. There was a continuing resolution. There was, you know, pieces of legislation that had to pass in order for the government to be able to function. And those took precedent over the organizational and committee work that goes into putting a package of non-controversial items together. So where we would have in the past been able to say, let's rally around this opportunity, this vehicle to move our legislation, we didn't have that opportunity this year. And there wasn't an opportunity, there was no package of Medicare bills that went through like that this year. There will be an opportunity in February. So we have this task ahead of us, a busy January where we're going to be pushing really hard. And again, the constituent voice is going to be so important. So you're going to see a lot of requests from us for outreach. We are going to be launching a new key constituent program. We're going to be building out some new framework over support for you all to engage with your members of Congress in different ways, including through our PAC. And so lots of great opportunities that we're going to be engaging with you all on in order to help us get this thing over the finish line. And we also have some new policy work in the future around a couple of other issues that we're excited to be announcing during the AOPA leadership, upcoming AOPA leadership conference. So be on the lookout for communications about those new policy endeavors as well. We have launched a new Advocacy of the Advocate of the Month program, and so I want to turn it over to Sam now to announce our AOPA Advocate of the Month for December, and then we'll stick around for some more questions that you all might have.
Okay, so here's the moment you've been waiting for. Our Advocate of the Month is Brandy Brown. Congratulations for your participation in our phone to action campaigns for advocacy efforts. We really appreciate your help, and we encourage all of you to, again, go to AOPA votes and make your voice heard. We really appreciate it.
Yeah, for those of you that haven't gone to aopavotes.org, please do go there. Make sure that you do both the Senate and the House letters. There are separate campaigns there. Add your voice, make it heard, and we also are here. So if you have questions about how you can get involved beyond just this letter writing campaign, please do not hesitate to reach out. And when we get into January, we're going to have some direct asks for you all as well, probably during these webinars. So please continue to come to the Advocacy in Action webinars as well. All right, let's do some questions. What do you got for us? Anything?
I am not seeing anything from the group, but I do wonder, is there anything that any of us can be doing between now and, when Congress breaks and they come back in January to help, besides AOPA votes, to help support our advocacy efforts?
I really appreciate that question, and I'll ask Sam to jump in as well. There is some fatigue at the end of the year, and I hesitate to say, oh, we need you to do too many things right now, because just like we're having trouble checking our own email, the members of Congress and their staff are having trouble checking their email. We have a few meetings coming up, but largely we see this as a moment of respite for Congress, particularly knowing that we don't have a vehicle to move this legislation at the end of the year. Getting the tally of constituents up, the number of people that are making this outreach, that can happen anytime. It doesn't matter if Congress is in session or not. Going to aopavotes.org is absolutely necessary for us to make sure there are more and more supporters of our bill recognized. But in terms of direct actions right now, I think it's time for rest for our members of Congress. Sam, what do you think?
Yeah, no, I would definitely agree with that sentiment. I think that when we talk to congressional offices, we can tell that everyone's just kind of getting the final end of the year things done and just kind of want to take a break after that. But I will add, kind of to your point about the fact that we can help you with congressional visits in DC. I think something that also can help our kind of constituent visits in like facilities. You can contact your congressman and see if they would like to take a tour of where you work, and then you can show firsthand how the policies affect you and your business.
And I'll add that has been the premise for a lot of outreach from members who've invited their members of Congress into their facilities, and then those members have subsequently co-sponsored the bill. So it does make a difference when they get to see how you engage directly with your patients, how you're the care that you're providing to them and the environment that you're doing it in. I think helps them connect the dots on the legislation itself. All right, well, we're rounding the corner here. I hope you all have exciting holiday plans ahead, and don't hesitate to reach out in the interim. If you do happen to have a relationship with one of your members of Congress, someone that you know in their office, a staffer, if you're actively involved at the local level in your area in terms of like local government or state government, all of that information is really valuable to us, and we'd ask that you share that with Sam and I. We'll put our emails back up on the screen here, and just reach out to us. Let us know what you've done, what you're interested in doing. Share those contacts so that we can help maximize the opportunities that you have to engage with your members of Congress, and how we can turn that around into support for O&P issues, particularly the Medicare O&P Patient-Centered Care Act now. And those of you that are active in your states, we have a lot of state initiatives in the works also, and I imagine one of these webinars coming up here will provide some overview of the state actions that we've been taking over the past couple of years. So look forward to sharing some more of that state work with you as well. All right, well, it doesn't look like there are any questions. I'm not seeing any coming in, so happy holidays to all. don't hesitate to get in touch with us, and we'll be back in touch soon. Bye,
Happy
everyone.
holidays. Thank you for tuning in.
Congratulations, Brandy.